Now we're going to see the amygdalectomy in the mesial lobe epilepsy. The amygdalectomy is the full removal of the uncus. So which structures or which parts of the uncus are removed depend on the vascular structures that we are seeing. So if we remove the anteromedial surface of the uncus, we will see either the bifurcation of the internal carotid artery or the proximal M1 segment of the middle cerebral artery. If we remove the vertex, we will see the oculomotor nerve. If we remove the inferior part of the posteromedial surface of the uncus, we will see the P2A segment of the posterior cerebral artery. The uncus is usually approached laterally when we do the anterior subpial approach. There is no clear demarcation between the amygdala and the globus pallidus above. So the key point is to find something that can tell us what is the superior margin of the resection. The best landmark would be the optic tract. However, the optic tract is not usually visualized on this approach. The next option would be the cisternal segment of the choroidal artery, of the anterior choroidal artery, because it passes below the optic tract. However, it is not always related to the superior part of the uncus. In the medial view, the upper point of the uncus is its posteromedial end that is delimited by the inferior choroidal point. Now, something that we can do to approach the superior border of the resection is to trace the carotid choroidal line. The aortic choroidal line is a line that goes from either the bifurcation of the internal carotid artery or the M1 segment to the inferior choroidal point. Between that line is almost the entire uncus. If we remove or if we go above that line, we can damage the globus pallidus, so it's not recommended to go above the line. If we go to the angle that is formed by the bifurcation of the internal carotid artery, we can damage the anterior perforated substance, so it is not recommended either. And the posterior margin of the amygdala intraventricularly is the prominence on the temporal horn of the lateral ventricle. After removing the amygdala, that would be after removing the uncus, we need to verify that we can see the following structures. These structures include vascular ones, that are the internal carotid artery, middle cerebral artery, posterior cerebral artery, and posterior communicating artery. Of the veins, we need to visualize the Rosenthal basal vein and the vein of the mesencephalic lateral vein. Usually the oculomotor nerve, the crus cerebri, the tegmentum of the mesencephalum, and sometimes the trochlear nerve and the superior cerebellar artery.